trying to text me at the same time. Thanks, Jen. Okay, so as we look at the framework of those 4 areas, instruction, operations, stakeholders, and communication and resources, the next thing that we started to do in our district is we looked at what is instruction and social emotional learning look like. So for those of you who don't know, we've been recognized nationally, statewide, and regionally as a social emotional driven district that has really looked at the social emotional education of students as being a core component of teaching and learning in Norton. We've been recognized nationally by the AASA, which is the Superintendent's Association, and we've been recognized by the state as well as a district that's really spent time and effort to try to do so. We've had a significant number of our staff that have been trained in trauma-sensitive schools, for example. The whole idea of how to deal with trauma within our buildings and within our families and our students. So these are all positive things. As you know, one of the most significant issues that's taking place in public education right now is that our students have not been with their peers. And the social emotional issues that go with that, we believe, are pretty significant, as much as we all as parents are trying to do our very best or even create those neighborhoods. One of the things I talk about with the school community all the time is as I drive through Norton or my hometown, kids are actually out in neighborhoods now. I haven't seen that in like 20 years. Everybody was getting picked up and driven to a basketball court or a soccer practice or something. Now all the kids are actually playing outside in the neighborhood. So maybe that's a good thing. When we look at instruction and SEL, we're looking at curriculum. What are the areas that we need to prioritize for our students because of either loss or because of areas of we believe need to be strengthened for our students? And then the second part is taking a look at how we can best do that. So we have those 3 models. We have the remote, we have the hybrid, we have the return to school. It's clear that face-to-face instruction is the best instruction. But how do you do that with the continuation of this C-19 situation? And that's what we've been asked to take a look at. The other part is, what are the needs of our teachers? Again, the needs of our teachers are significant, but not necessarily because of anything except that we've changed the priority of teaching. Some of you might have suggested to me in the past that your child was behind a computer too often when they were in school. Now we have the opposite discussion from other parents who are actually saying, how do I actually make sure that my child is getting what they need if I'm remote or hybrid, because the student is not in front of a teacher on a daily basis. We also have to think about the health and safety of students as a priority and our staff. And then the last part that goes with that is, how do we make sure that anyone who's in our buildings, including our substitute teachers, are trained to the point that they need to be if in fact they are either providing a hybrid service, a remote service, or a face-to-face service. It's completely changed the game for everybody involved. When we look at support staff, we have to take a look at how those roles have changed. I'm talking about our paraprofessionals, guidance counselors, team chair people, psychologists, adjustment counselors, and others. PT, OT, and speech, and how we deliver those services to students in a hybrid or remote model. These are all of the things that we're currently working on. What does the school schedule look like in any of those 3 models? We clearly know that if we're doing more hand washing, and we have to be careful about students passing from classroom to classroom at the secondary level or from going to lunch, that you're going to need more time, which means less time teaching and learning. So the components of all of this is, how do we balance all of that in a day-to-day operation in any of those 3 models? And that's what we've been asked to do. All of that within the foundation of contracts. I have contracts with individual contracts with folks. Those are easier for me to work with, but I have teacher contract and para contract are under the Norton Teachers Association. I then have administrative assistants, and I have custodial, and then there is a private third-party contract with food services. We have currently served, since March 16th, over 40,000 meals in the town of Norton through our food services program at 0 cost to the town of Norton, all of it through federal assistance and so on. So thank you, all of you, and hopefully you have a neighbor or you yourself have taken part of this. Thank you for doing so. It will continue on until sometime in the middle of August, and then we will have to unfortunately shut down because of transitioning into the next year, depending on the model that we're working on. When we look at operations, we have to look at Technology, as I said earlier, we will be one-to-one. Thank you, Karen Winsper, our Director of Instruction and Technology, who's been a huge lead on this, and her support staff that work with her. Again, those are funds coming through the Municipal Care Act, where we've been able to purchase our one-to-one, and we will be ready to go as soon as those tech items come in. It will be iPads in grades K1, and it will be Chromebooks 2 through 12. We will be fully 100%. We'll also have iPads, by the way, in pre-K. We've taken care of those internally. But we will be fully utilizing and full ready to be online as a district for September, pending any order that doesn't come in. I'm only saying that because things can happen, but the fact is I think we're in a good place. When it comes to facilities, our facilities have never looked better. And the key to that was our custodians wanted to work. They wanted to come to school every day. They wanted to make sure if we had the paint, they would paint the walls. If we had the wax, they were going to wax the floors. So in terms of the cleanliness of our HVAC system, of our floors, of our classroom cleaning, we are in a good place. We still have things to do because it's the typical summer, but we're in a really good place because those men and women in that department continued to work every single day during the Corona period that we were home. And so when you look at everything to do with the time period, those folks worked for us. Our food services, although a third party, they are also, many of them, 11 of the 18 of them originally employed by us and now we're Chartwell's. Those 6 people have been working with us since March 16th. If there's anybody that I would consider a first responder, it would be our food services personnel. And our custodians. And then lastly, in that area of operations is everything to do with one of our favorite topics in the town of Norton, and that is bus transportation. As you know, there's a fee for pay and ride, and then there's the if you will, the federal law under where we have to provide. This is going to be a very controversial topic going forward for a number of reasons. One of which is that the state is pushing 1 student per seat only, or siblings riding together. So that is going to be one of the biggest headaches that we have to, that we literally have to try to deal with. I'm just putting that out there, but it is a 1/3 model that's being put together. And then the last one is the health and safety of our schools, making sure that we have protocols and procedures in place, which my group is actually working on. And that in itself is controversial because of what I stated earlier, 3 feet versus 6 feet. When it comes to 3 feet, we can pretty much run our system except in one area, and that's the high school. When it comes to 6 feet, we cannot provide anything except for a hybrid model. So let's repeat that again. When it comes to 3 feet, we can provide pretty much in K-8 without any questions, some of the high school, but not all of the high school. When it comes to 6 feet, we can only provide a hybrid model, which means time at home and time in school, splitting classrooms 50-50, if you will. So I'm just putting that out there so that you have it as a factual piece of information for Norton Public Schools. When it comes to communication, it means something different for all of you. I have asked to see if we have the potential to provide families, if we're in a remote or hybrid model, support from our before and after school program champions, or from kinder care programming as well for the younger children. Every single family is going to have to deal with this question in a different way. In some cases, you may be back to work and you're able to work from home. In some cases, you will be able to speak to your employer and say, my school system's doing X, and can I work from home A and B and C and D, work in the office? In some cases, it won't work for you at all. And we understand that. I think I've said this in a couple of other parent meetings that some of you may have attended, that this is probably some of the most difficult decisions that we have to make, because regardless of the decision we make, it's not going to necessarily be a good decision for certain families. When we look at our teacher and staff, we have to be mindful that of the almost 400 people who work in Norton Public Schools, we have a significant number of people who have children under the age of, let's say, 8th grade. That is an issue. There's federal legislation that provides them the opportunity for childcare. And potentially, and I use the word potentially because every case is different, staying home, not coming to work, still being compensated, and then how do you backfill positions? So if all of a sudden I have 25 teachers who can't teach, that becomes a major part of a decision that I need to make about remote or hybrid versus full return, or even hybrid and return. Medical excuses, for example, medical conditions that are allowed to be able to be communicated with the employer, meaning my office, and following through. So in every single case, each of these for the employees becomes a very individualized item. We are looking at our before and after school program being able to potentially be available in all 5 of our schools. Now, high school, we're probably not going to need that, but in some cases through middle school, that could be an area. As you know, some of you may recall a couple of years ago, we actually tried to do champions at the middle school, and we only had about 8 families that wanted to partake. It just wasn't worthwhile. When we look at the issue of resources, we still, in Norton, we have voted at the June 27th town meeting a school budget. We have a budget. Here's the problem. We do not have a state budget. Because we don't have a state budget, we don't know if Chapter 70, which for us was a $72,000 increase under the Student Opportunity Act, SOA, what this means is because we don't have a state budget, we don't know if there's actually going to be a cut to Chapter 70. If it's $72,000 out of the SOA, we're going to survive that. If it's a 5% cut, that's $600,000. If it's a 10% cut, that's $1.2 million. Both of those numbers are devastating to us. Those are layoffs. And how do you do that while you're trying to play catch up and to deliver services and an education? I'm not a betting man, honest to goodness, I'm not. But if I was, I would say that I think we're going to be okay there. That's what I'm hearing, but that doesn't mean that that's necessarily what's going to happen, and I can't tell you that definitively. When we look at items like preschool, very definitive area, a service delivery model required by law for students on an IEP, and peer model students that are part of the program where we charge a tuition. What is that going to look like? How do I turn to families and charge them $350 a month for remote learning or even hybrid learning? If anything, we would have to come up through the school committee with other financial scenarios, including the potential that there isn't much of a charge there if it's remote, because we're trying to have students be part of a classroom. So that is a critical area. We still don't have a direct answer for that. And lastly, in terms of this, and then we'll turn it over to Q&A, we still don't know anything about athletics except that it was moved today to September 14th as the start date by the MIAA, and DESE is going to agree with that. Transportation regulations will come out in the next, well, to go back to athletics, I did request through the AD's office communication to captains that captains' practices are not active until after August 10th. And that's the reason why we're hoping for some new information. And the sole reason for that is right now, which is great, we have kids who want to work out. My own daughter is being driven to Norton to go to volleyball practice, if you will, captain's practice. But what's happening is we're having 100, 120, 130 kids on the track. We're just trying to be as safe as we can. And since the season is 7 weeks away, at this time, we are stopping those things from happening on school grounds. July 31st, next week, we must file electronically with the state, kind of like this is our issues. This is what it would look like if it was hybrid. This is what it would look like if it's remote. This is what it would look like if we were 100% back. And then on between August 1st and the 9th, we'll be having some discussions. I'm happy to announce tonight that on August 4th, 5th, and 6th, we're going to have open forum opportunities with the school committee, and then potentially a vote on August 6th or an emergency vote on August 10th. August 10th, we have to file with the state that evening. So we're hoping that we can make the decision prior to that, and we'll have a general education school committee meeting on the 4th to kind of discuss the models and the issues, the pros and the cons. On the 5th, we're kind of making that kind of a public hearing, an opportunity for the school committee to hear from you. And then on the 6th, either they make a decision or continue to collaborate and communicate and make the decision on the 10th. And we would have to have the report and everything done on that day and just hit send after that meeting. All of those will be published, and we'll get you those times so that you can participate as part of that. Today's meeting with the commissioner, just to give you all an update, there was a meeting with the commissioner today. There are discussions taking place between the commissioner's office and the Massachusetts Teachers Association, which represents the locals, or the American Federation of Teachers, and the third group is the Boston Teachers Association, Teachers Union, which actually is meets on their own behalf. Right now, the difference of those discussions are pretty significant. There are some areas where they agree, but there are significant areas where the state's commissioner and the unions do not agree. At the local level for us, I'll be going into executive session tomorrow night with the school committee for the sole purposes of discussing collective bargaining, which means I'll be providing the school committee an update on behalf of what the unions are asking for. And then from there, based on the decision that we make, we will impact bargain with the union and attempt to come to a resolution by both sides. And I always feel comfortable that the school committee and the union always works to collaborate together to try to come to a resolution. The same between the two parties is always that Norton is going to do what's best for Norton, and that means its employees as well as its students. And what I always say is what's hopefully good for students and fair for staff. And we try to move forward in a way that gets us to make sure that our students are being educated in one of these three models, depending on the decision. Lastly, just for the sake of discussion, as of today, we have on site or ordered 5,000 disposable masks, 2,000 what's called clear masks, where you can see the face, if you will, 3,000 gloves, 1,000 disposable gowns, 200 face shields. Many of those would be used in specialized areas. Same thing with the gowns. We currently have 5 electromagnetic sprayers that we've been using since the spring. We have 5 backpacks on order and 5 pump sprayers on order. We've ordered 175 desks for the high school. We have 500 gallons, or 1 gallon for every classroom, of hand sanitizer in office. We have disinfectant wipes, which will be used by adults. They are not recommended to be used by children. We're ordering tents for the outside of every school. And we've ordered 200 folding tables for the purposes of lunches as needed. All of that paid through the CARES Act funding. So are we ahead of the curve? I don't know if we're ahead of the curve, except to say we're trying everything that we can to get there, or to at least be able to provide the best model for the school committee to decide on as we go forward. And lastly, there is a 19-page document. I'll make sure that it's on our website tomorrow. There's a 19-page document on COVID-19 response scenarios. We will be taking that document and creating our own Norton document for as many different scenarios that we can think of in terms of how to best respond to an actual situation. All right, so this meeting is really about taking your thoughts and your ideas. Criticisms are always, I always say, are welcomed. My response to criticism is also come with an idea, because I think none of us have all of the solutions. My job is really to provide you as much information as I can to keep you in the loop of that information. I think in general, Norton Public Schools has done a pretty decent job of that. And where we have failed, we've tried to attempt to improve. So I don't know, Jen, if we want to open up to take ballpark Q&As.
Yep, we have several questions already. So I'm just going to start with the order they came in. Does the Norton Department of Public Health have a communication process with the Massachusetts Department of Health?
Yes,
they take a plan for notification, etc.
Yeah, so the way that the process works is that they take the lead of information from the Mass Department of Public Health. It comes to them, and then they're able to utilize local data and information. They could take a look at buildings, take a look at facilities, take a look at how we're providing things. And a perfect example I can give to you is our graduation that's coming up Saturday. We had to meet a number of local guidelines. They physically walked it themselves. They looked at what we're trying to do. They provided the actual space that we needed to have. They helped us to, through emergency management, they helped us to actually square off all the squares that we have set up for the graduation where families can sit together and so on. It's the same thing for the 5 buildings based on the decision that will be made. Now, here's what's controversial. You've all been reading about how different school systems are already responding to this, and I'll give you an example. The town of Lexington, since day one, has stated through their Board of Health, we will not accept anything except less than 6 feet. That's their determination as a local Board of Health. That's not where we are in Norton with our Board of Health. But that doesn't mean that the Board of Health doesn't say that, hey, listen, I'm really worried about having 730 kids in the building, or 600 kids in the building, or 500 kids in the building. I would prefer to go with a model that supports having less physical bodies, and therefore the 6 feet. Those are the final determinations that they will help us with.
Okay. Question was, will temperatures and symptom screenings occur before entry to the school?
Temperatures will not be taken. That is not the recommendation because of false positives. And I guess you could also say false negatives. But we will have a screening protocol requirement, if you will, on the honor system that simply says, please take your child's, if we're in fact in a hybrid model of back to school, please check your child's health, please check off. We are going to try to do that if we can electronically prior to coming to school. But to be quite honest, it is an honor system. None of us are medical doctors, and but we are going to seriously say to you, please check for the symptoms. Those will be outlined. We're currently doing them in our summer school extended school year program. That's just started this Tuesday. It's a protocol before you come into the building and you drop off your child.
Okay, the next question is in regards to, do we set up any classrooms with a, 3-foot distancing versus 6-foot distancing and numbers of students that fit?
Yeah, so we've done scenarios in every building at 3 feet and 6 feet, and then looked at what needed to be taken out of the classroom in order to meet that. And this is where we run into some issues. Specifically, we run into issues at the high school. We have currently 28 sections at the high school that it's significantly problematic for. When we look at the middle school, it's less of an issue in 7th and 8th grade. It's a little bit more of an issue in 6th grade, but even again at 3 feet, there is space there. The issue always comes down to how students shift their desks and move around and so on and so forth. You have to remember that in K to 5, pre-K to 5, we no longer really teach anything in rows. The only time you see our kids in rows is during MCAS testing. Our students are predominantly in groups, in pairs. Students are being taught in a way that's, much more of a, if you will, a grouping of learning. At the secondary level, even in our new high school, we have about 60% of our rooms are all some type of a lab table. In other words, students side by side on a 5 or 6 foot table. Because that's the new way of teaching and learning. Flat tables, not leaning tables, because you're one-to-one and you need your device to sit on there. And that's a problem for example, at the middle school, because most of the desks kind of lean a little bit because they're one-piece desks. So we ran those scenarios and we run into some issues in our schools, but predominantly we have issues at the high school. And then at the rest of the schools, our next issue becomes, and even the high school, our issue becomes everything to do with lunches. Lunches are a big issue in terms of having students being able to actually go to a lunch. At the high school, for example, we ran a scenario that in order to be able to keep every student at their own area, we would have to have 18 lunches. Well, you might as well start at 7:50 having lunch, because it would, half-hour lunches, it would take you more than the entire day, as one example.
Will transportation be free this year?
No.
Okay.
I know what the question is. The question comes down to how can we make sure that we're getting everybody to school? But at the end of the day, we're required by state statute under mandatory and pay and ride. Right now, the priority would be mandatory and then seats available for pay and ride. And that's going to be problematic. For example, if we were to try to do that recommendation, we're looking at adding, based on the 1/3 scenario, somewhere between 9 and 12 more buses at $65,000 a piece. You can probably figure out the math with that.
Sounds expensive. What about students in K and 1? Will they be required to wear masks? And would that influence the 3 feet versus 6 feet?
Right. Right now, the recommendation is at 3 feet minimum, 6 feet preferred from the DESE, that students in pre-K, K1 and 2 would not be wearing masks, and including students with medical conditions, including behavioral issues. That is the current recommendation. If we were in a hybrid situation, it does make it a little bit easier because, again, 50% of the kids, we can definitely get the 6 feet in the classrooms. When it comes to all the students coming in, that's problematic all around.
Okay. Are parents going to have 3 options to choose from in regards to coming back full-time, coming back as a hybrid, or coming back remote? And what will be the supports if they do choose remote?
Right. That's a great question, and one of the more controversial questions, believe it or not. So right now, coming back to school with remote is a potential option for some families. The idea of hybrid and then with remote is a potential for family. The issue becomes, how do you do coming back to school or hybrid? Because what would happen is, if we're back to school, the idea is to attempt to look at trying to keep your cohort of students as much as possible together. When you have a student that is only joining that cohort for a period of time, you have not only a physical health issue, but you have an academic issue because they're not getting the same academic day-to-day as students would. So right now, we're not saying no to that, but we're saying that would be a difficult thing to do because of students being in and out by parental choice.
Okay. Will students have to take MCAS this school year?
Well, as a superintendent who's been asking to get rid of MCAS since I've been a superintendent, I hope not, but that answer has not yet been addressed. I think everybody in Norton knows I have not been a proponent of one test. I believe that students learn differently, that there's multiple different ways for us to assess students. MCAS is just one test. I'm going to guess that they're probably going to keep the secondary test as a graduation requirement. But if we have schools on hybrid and kids are schools in remote and schools coming back and we're all over the place, how does that come to any kind of equity around the state? So I don't know what's going to happen there, but I will tell you there has been a bill filed and supported to get rid of MCAS, at least for the time being. I don't know how much love that's going to get.
We heard that there was a possibility of no new school choice this year, or only kids that were already there were going to be allowed to continue.
No, we've had an open school choice from the vote of the school committee going back to, I believe, February or March. And we have had students come in via school choice, but our numbers are actually probably going to be slightly up of new students or pretty much stable depending on what we actually do for our choice. This is going to come down to, in a lot of cases, family decisions, i.e., I go to Norton under school choice, Attleboro is going to school full-time, Norton is going remote. Bang, I'm going back to Attleboro. That could happen. Vice versa situation as well. So we are still a school choice district. We did have limited seating, and we have not seen a significant increase this year in our seating.
Okay. Can you give an idea of how remote learning could be implemented for younger students, for example, K and 1? And if the parent's working, they can't really support the learning process. So Karen, I know you're on. Would you want to talk about the remote learning committee and what you guys have discussed on that end?
Sure. We have met several times, and we have representatives from all grade levels, and we have really focused thus far on looking at scheduling because we know that the spring, we'll call it emergency teaching, was less scheduled. So we're looking at really trying to provide a more scheduled experience for all levels. So pre-K to 12, looking at trying to provide opportunities for students to choose their electives at the high school and be able to fit those in, and have students be able to have their core classes as well as the specials at the elementary and middle school. So it's challenging, because we also are trying to balance the amount of time that children are going to be in front of a screen, as well as the synchronous time, which is that direct teaching and that direct instruction by teachers. We don't want students or teachers in front of a screen all day, but we're also looking at providing opportunities for our special education students to receive services. So there's a lot that is involved in that process, but we do have some preliminary schedules that we feel confident could work in a remote learning environment.
Thank you, Karen. If the students go back at full capacity or hybrid, will they be switching at the Yale for math and ELA? I think our plan at this point is the teacher will move instead of the students moving from one room to another.
Right.
When do we expect to let parents know? I believe that will happen once the school committee has made their vote before August 10th or on August 10th. Will the special education students have more in-person teaching?
Well, there's a lot of models that are in play with that, so I think that's a really important question. Here's what I can say, a couple of recommendations that we're seriously considering. When we're looking at students in separate programs and in preschool, we are seriously contemplating those students being in school at least 4 days a week and potentially 5 days a week. That is under the guidance of the Department of Elementary and Secondary Education for students who are significantly need the support that they are provided. When it comes to everything to do with students in inclusionary services, students receiving, let's just say, OT or PT or speech or just speech, those are the type of services that, depending on what model we bring back to what we bring to the table, those are the type of models where if we're in fact doing hybrid, we're going to have teletherapy at the same time. If we're doing remote, we're going to have teletherapy the entire time. And that's some of the commitments that we've made going forward on how this looks like in terms of student services. When it comes to the inclusion, how do we do supplemental and support services to those students within the general education classroom? Those are all things that we're working on right now. What are the platforms that we're going to use, and what are going to be the requirements, considering that a special educator may be working with 3 or 4 different teachers, not just one teacher.
Will the model be the same across all schools and levels?
Great question. I would say as of our look at this, not necessarily. We have had some internal discussions administratively at looking at an elementary level versus a secondary level. We've actually also thought about a pre-K to 2 or pre-K to 3 versus 4 to 8 versus 9 to 12. So everything's in play as far as we're concerned. We do have some shared staff, so we would have to figure that out in specialized areas. But to be quite honest, that would be the least of my concerns.
If the school does open in a hybrid model and a parent chooses not to send their child, is that okay? Are they penalized for attendance? If a parent decides to have their child stay home and learn remotely, we will have options for them. We will have a remote learning plan for any family that decides that that's their best option.
Yeah, I think it's really important for people to recognize that one of the things we're trying to do is provide a public education to all students to the best that we can, number one. And number two, to provide some type of flexibility to families, recognizing that it's not a one shoe fits all for numerous reasons. Number one, that those decisions are something that we really want to work with families with. And number three, it is a core belief of what I stand for as an educator. If I can find a way to meet the needs, I want to be able to do that. I can't assure you that that's going to happen in 100% of cases, but that's what keeps me up at night, is how do I make sure that the town of Norton's taxpayers who send their children to the schools have as many options on the table that are reasonable to be able to provide an education. And I'll give you an example, if I may. Instead of just thinking about, I'm just going to homeschool my child, let's have a discussion about how I can give you the actual platform keep you registered, keep you supported in some ways, and it costs you nothing. Or provide you a model where maybe your child's speech services have to be provided in a different way after school hours. Those are the types of things that we want to have conversations about, because this is such a unique circumstance that we're in. One of the questions that always comes up, and I stated this earlier, is our goal in public education, as far as I'm concerned, and maybe the one thing I've always tried to think of, and I know members of my school committee are on this call as parents and as school committee members, and that is that we should be able to try to find flexible ways to support as much as we can. There's always going to be at some point a no, but the fact is we should attempt to have a yes as often as we can, and that's always been my goal. I think school choice has been an example of that. I think students being able to do dual enrollment. We just recently had a student who graduated from Harvard University Extension School because we were able to work with that family with flexibility, and so on.
Regarding lunchtime, students can't wear masks, so what's the plan there? They have to be at least 6 feet apart in order for lunch, so that's another issue when we think about having all those students there at the same time. Regarding the 3 back to school models, are specific parameters and plans being developed? Yes, they are. We are coming up with very specific plans for all 3 scenarios because we have to be prepared that at any point we could need to go from hybrid to fully remote, back to hybrid again. And obviously the goal is to have all students in school at some point this year, but yes, we are being very specific in those plans.
Because there's an impact on collective bargaining when it comes to this. Tomorrow night, the school committee in executive session, what we rightly can do, because they can go into executive session for the purposes of collective bargaining. Some of those models will be discussed with them more specifically, because there is a impact to the teacher contracts and the para contracts. So we don't publicly announce that right now, but we will be announcing that as we get closer to them making a decision and getting actual information from the public. So in other words, our attempt would be to release as many specifics as we can on by August 4th to all of you. We'll do it electronically so that you have it in front of you. It'll lead to a ton of questions. That's hopefully how we can go from the 4th to the 5th, and then finally move to a decision on either the 6th or the 10th. And the decision stands by statute with the school committee.
Do we plan to start school the week of Labor Day on time?
I would say right now that is a tentative no. The reason for that is we're probably going to be given some type of flexibility to have staff come in for specific training around PPEs and whatever model we're doing. I think we're going to get somewhere between 3 to 5 days of flexibility, which would mean the week of, I think it's the 8th of September that we start. We'd probably be looking at the following week, but do not put that on your calendar yet. And I promise to get you that answer sooner than later, because I know there's an impact. But the idea is that we're going to need more than 1 or 2 days of training on whatever model we're doing with the teachers. I don't think it's going to be, 8 or 9 days, but I do think it's going to be more than 2 days.
Okay. People said that, thank you for these Zoom calls, thank for the work. If we decide we want remote learning for our children, will information on how to do this be provided, and if so, when? Yeah, so when we make the decision to, let's say we make the decision that we're going hybrid and you decide that you want to go remote, or let's say we make the decision we're coming back and you said we're going remote, we're going to give you, I hate to call it an application, but we're going to give you some type of a form and a choice so that we can fit you into a process. Because we then have to figure out who's going to be the person of record to deal with your child. What program are they going to be using? What platform are they going to be using? What kind of check-ins are they going to have? Who's responsible for grading? All of that stuff will be part of that process. Okay, let's see. Sorry, I'm going down trying to answer some of them at the same time. When the final decision, we already discussed that question. If the hybrid model is decided to be the best option, will there be an effort to ensure students from the same family attend at the same time?
Say that one again?
Are we going to try and keep families together in a hybrid model? Yes. That's
Yes,
our
we
goal.
are. Can I guarantee it's going to be perfect? No,
No,
I can't. I can't. I wish I could, but I can't.
but that is the goal. Okay. Another question about remote learning. There's a lot of conversation within the medical community about another COVID peak. Will these models be developed to easily transition if we need to?
Yeah. So one of the reasons, it's a great question. If I said earlier, you know, I'm not a traditional betting man, but if I was, I believe we're going to have a peak at some point, and we're probably going to be full-time remote. Remote will look differently than it has in the past, as I said earlier, significantly different. But yes, that's part of some of our models speak to a remote day for students, half day, and then second part of the day on that remote day. So let's say it's a hybrid model. Some of our options would be that we've built in half days as part of a remote day in order to work with our staff in transitioning to something that would be fully only remote. So that we're providing the professional development. One of the things that we learned is, you know, it's 2020, and we still have this title called 21st Century Learning. We're 20 years into the 21st century, and we still have families and parents and situations, unfortunately, where people don't even have connection to the internet. We are in 2020, 20 years in, and we're still having to learn technology. I'm one of them. I can't tell you how much I've learned in the last few months, and my staff are on, some of my staff are on this call. They should all be shaking their heads. So I'm a novice that's learning. We've attempted to try to give this information as much as possible to our staff, but we're going to require more training, especially when we're fully, if and when we're fully remotely.
There was a question about Chromebook access. That all of our students will be one-to-one. Our students in grades 2 through 12 will have access to Chromebooks. Kindergarten and first grade will have iPads. And if we are fully remote, all students will be able to bring them home so that they have access while they're learning remotely. Question regarding purchasing an online platform for remote learning, and what will the involvement of our teachers be at that point? And so, yes, we have purchased some online platforms. You know, there has to still be a connection between the teacher and the student, even with an online platform. So teachers will still be designing instruction. They will still be creating assignments for students. And then the other question is, will teachers be required to live teach those remote students if they're already teaching during the day? And that's part of, you know, the planning that we're doing right now, is trying to make all the pieces fit together, because it's very difficult to be in two places at once. So, you know, how can we provide our students that are remote with synchronous instruction versus if they're not able to kind of, you know, beam right into the classroom there? What does that look like? And who do we have that's able to do that? So all of those things are still being figured out at this point. When we hear what hybrid teaching looks like, will the kids be split in half and go every other day or every other week?
Those are the models we're working on currently. We've been looking at, as an example only, a remote day for everybody on Monday as a half day, then going, for example, K to 8, going Tuesday, Thursday, and the other half going Wednesday, Friday, just as an example, or 2 days on, 2 days off consistently, or half days. Half days are hugely problematic. Studies are clearly articulating that half days are not the way to go, but it is something that's still in play.
Has the district been keeping up with the news on the hand sanitizer recalls? Yes, we have. Our director of facilities is all over that. So good to know.
We don't have any of it. We're very lucky. We don't have any of the recalls that took place.
Is Norton only implementing one model?
No. No, we will look at a recommendation of a model and potentially have the opportunity. Let's say we're hybrid and a parent doesn't want to send their child, then remote is in play for those families, and that's per DESC directive. They're saying that it's a choice in play right now. The controversial one is if we're doing one of the models and parents want to have that back and forth. So let's say we're in a hybrid model and parents want to choose remote, that's pretty easy for us to do. But if we're in person live the entire time, so we're returned to school physically 100%, and a parent wants to do hybrid, that's going to be a little bit of an issue.
A parent asked if we'd be sharing these questions out with the community. We actually can do that. We get a full transcript of the Zoom call, so we can send those out to families tomorrow. What is the proposed incident response in the event there is a child or a teacher who becomes infected?
Yeah, that's a protocol that that's a great question. So that's a protocol that will have to be in literally not only in the hands of staff, but in your hands prior to the opening of school and whatever model we're in terms of a physical model, either back, return to school, or hybrid. And those models are very specific that have been outlined in terms of protocol. So an example might be if there is a C19 case in grade 2 at the X school, what does that mean for that classroom? What does that mean for where students have been, and what does that mean for that building? How does that impact actually the entire district because of family members? So there is a impact protocol that will be in place. I'd also like to announce tonight that our crisis management for this will be going electronically inside. So internally, between my office and all of the different personnel in charge of different crises, all of it will be done via electronic app going forward, which will make it, I can actually respond to that from anywhere in the world as long as their internet connection. And that will allow for me to take an incident on a Sunday and put the protocols in place from Monday morning, of course, within reasonable time, but I can allow for the crisis team to be called and put into place for that reaction right away. We purchased that software. We're currently working on putting it together. The software comes with 100 different types of crises responses, including C19 as a new response. And literally, we just completed that in the last 24 hours as an opportunity for my office, along with everybody that's responsible for crisis, including on the town side, getting information from me and being on that response so that we have as quick of a 24-hour response active live right away as possible. We're actually quoted today as being one of the first communities in the Commonwealth to have that program. Really proud of that because we've been working to try to find something that was beyond a piece of paper or a booklet that you could go to and say, how do we respond to this? Now we have it all live and available to us, coming your way really soon.
Will there be criteria set in advance that will trigger a move from in-person to hybrid or hybrid to remote if case counts increase? And will that be based on town counts, Bristol County, or statewide?
Yeah, so here's the thing. Currently, as of July 7th, my latest numbers that I have, so it's a couple of weeks already away, and things have changed somewhat. At that time, we had 164 cases of C19 in the town of Norton, 5 unfortunate deaths. We had 5 cases under the age of 18. That was our numbers. If you look at Bristol County, those numbers in general have been pretty consistent. So this is part of the debate that takes place around how do we respond to C19 and not come to school? And we don't have Chelsea numbers or Boston numbers or Worcester numbers or other numbers like. We have significantly less data. Of course, that's controversial. Staff comes from other towns. We actually have about 150 students that come from other towns. You may be going out every single night to restaurants and everything else and coming back. We have people that are in Florida right now. Are they actually doing the quarantining when they come back, and so on and so on and so on. But I do think it's important to utilize local data as part of our day-to-day look at what we need to do, and not just a number that comes from the state. I think we have to look at what's happening. We have been very fortunate in Norton. I actually live in a community where the numbers are significantly higher. I also happen to have an autoimmune disease, so I'm very careful about where I go. constantly wearing a mask and going through all that process. So when you look at this, we really want to use data and information. People don't like it when I say this, but I'm going to say it yet again. We train constantly around trying to be safe first and foremost. There is nothing more important to the superintendent. It's not MCAS scores. I'm sorry. It's not. That's not really my job. It's the safety of my buildings for my children, my students, and my staff. And how we respond when there's a situation. That lies 100% on my shoulders with support from many. I can pretty much clean just about anything, put anybody in any garb that we want, and I cannot guarantee you that a C19 case will not happen in Norton in our schools, period. All I can do is do the best preparation for the safety of our children and our staff that work in the town. That's all I can do every day. What happens after that can be criticized if something happens and we didn't do it, absolutely. That also is on my shoulders as the superintendent. But the key for me is to make sure that the health and safety is at the best that we can provide. And so for me, this decision is critical. And I know that the 5 school committee members, of which some of them have children in the system, I believe they have a desire to keep their kids safe every day. So safety will be a proponent of this or a concerted effort of this. But let me finish with this. As a parent, the social emotional development of children, to me, is at the core of this debate. The idea that we continue to not have any interaction of peer development with our kids is a huge issue for us to put on the table as part of this decision. So we have a C19 issue that's a health issue that can go back most likely to the adults in the building. But we also have the social emotional development of our students. I don't know if any of you have seen changes in your children or if you've noticed struggles that they didn't have before. Many of those are around the psychology of who we are as human beings. I will tell you, I don't lose my cool very often, but there's an assistant superintendent on the call today who saw me lose my cool because I want to be with my kids and my staff. I hate my job right now. I hate everything about it because I'm not allowed to do what I like to do. That's just me. That's not an ego thing. That's just who I am as a person. I think our kids are going through that as well. So to me, we have to make sure that we're safe, but that safety needs to include difficult discussions around the social development of our kids.
Will we be using contact tracing within our schools?
As much as possible, yes. We're working on some protocols where anytime a student leaves their cohort, goes to the bathroom, goes to another room, whatever the case may be, that we're trying to, if you will, track that as much as we can. Will it be perfect? No. Can you call it contact tracing? I'm not sure you can, but we will attempt to make sure that we're trying to make sure that we have a record of where people are as much as possible, including adults in and out of the building, which, by the way, the idea of volunteers, we're probably going to start with probably not allowing volunteers into the building, at least for the first couple of weeks of school, if we're back in any way.
Questions regarding where students will be eating lunch and how we're going to make that safe for students with food allergies. All of those questions are things that we're currently working on in our return to school plan, looking at, providing our students safe distance because they do need to be 6 feet apart when they have their masks off for things like eating. So we will be making sure that we're putting in parameters for food allergies as well. There's a question regarding curriculum. If we're starting where we left off in March. From my perspective, there's a lot of research out there that talks about the acceleration of learning instead of going straight to remediation. And really what that means is if we continue teaching third graders second grade curriculum, we'll never get through all of our third grade curriculum that we have to teach. So instead, introducing students to that grade level curriculum and content, and then filling in gaps as they come up. So not every student will need to fill in some of those gaps. So that's the approach that we're taking with that. The best example I can give is around fractions. So if a student was supposed to be learning what an equivalent fraction was during the spring, they probably were introduced to it. But now next year they're working on adding and subtracting fractions. We'll go back and make sure that they have a good understanding of equivalent fractions before we start teaching that new skill. So instead of starting with straight remediation. A question here regarding our ESL students. Will we be, doing more than one Zoom meeting? Absolutely. Questions regarding when we say remote learning, do we mean synchronous or asynchronous? That is definitely going to be a combination of the two. We know that that was probably one of the weakest areas of our remote learning process this spring was the synchronous instruction. So that is definitely something that will be happening.
And can I interject on this for a second? I want everybody tonight to take the idea of remote learning and blow it up for a second. It's gone. It is going to be a whole different animal coming back. Okay, let's all think about all those positives and negatives. We are in crisis mode and we did the best we could. We know where the holes are. We know where the attempts were made. We know where there is lack of equity, but we did the best that we could at the time. So let's blow up all of that and just say, how does this look like now coming in? We're looking at a lot of different options around remote learning that are a lot more synchronous, or I'll just call it structured. Let's just use basic language, structured. Teacher-directed instruction with students. All of that, yes, has to be negotiated. And I know somebody said something about why do we have to negotiate. If you want to not negotiate, I'm sorry to my teachers on the my union members that are on the call, and I don't mean this disrespectfully, then call your state rep and ask them to change chapter 150. I can't do it. I have to negotiate by law with the school committee. So talk to them about how to change the state law that you don't want them to be able to do that. Otherwise, which has been around for decades, otherwise I have to follow those rules. I'm happy to follow those rules. It's not easy, but we usually find ways in public education to handle it. But think of the idea of remote learning differently from what you had in March 13th going to the 16th, where we had 2 weeks, almost 3 weeks of educational supports and all of that. And then we went to twice a week and this and that. I need to renegotiate and change that. I know that my union knows that it needs to look differently as well. There's a ton of issue of equity, not only for students, but for staff that needs to be addressed.
There's a few questions here regarding using plexiglass at tables or in the lunchroom.
Yes. How's that?
We're looking into it, yeah.
Yeah, we're looking into it. It's incredible how I could go buy plexiglass a couple of months ago for about $2.99 a piece. And now it's about $299 a piece. I love capitalism at its best.
Supply and demand.
Incredible.
Who is making this major decision?
So let me be very clear. The regulation is clear that the Norton School Committee for the town of Norton and all local decisions are made by the local elected school board or appointed. There's only 2 in the Commonwealth that are appointed. Unless the governor steps in with some type of state of emergency statement. I would say that that's 0.01, less than 1% chance that's going to happen, the way I see it. Unless all of a sudden the numbers tick up in the next few weeks, then maybe we could see something. Right now, it's a local decision by the school board. The way we typically work in Norton, Mr. Savas is on the call, he's the veteran of, is typically the school committee is looking for me to give them as much good information as I can give them for them to make that decision. I typically make recommendations on almost every critical issue. That's the way I believe and what I'm hired to do. So it's a recommendation based on data, information, what we're hearing, what we're seeing, what we're theorizing, and we give it to them to make the best decision that they can.
There's a question regarding online resources and, the fact that so many were offered for free this past spring. Karen Winsper and I have been working very closely together to take a look at those resources that we do need for both hybrid and remote learning. And thankfully, some of the grant money that Dr. Bayetta mentioned earlier has been put towards purchasing a lot of those resources for our upcoming school year.
And Jen, just to add to, if that question infers anything about charging them, if you are enrolled in Norton Public Schools, I cannot legally charge you for any of those. If you unenroll and decide to do your own thing and you want to use my resources or our resources, then I can charge you a reasonable rate.
Couple questions about switching classes at the middle school and high school level. Want to address that, Joe? Or
yeah, so you can't run a middle school and a high school without changing classes. It's that simple. The question becomes, how do we minimize that, which is what we've been asked to do. At the middle school, it's somewhat a little easier. At the high school, it's a significant issue because you have AP classes, honors classes, CP classes, and a ton of electives. So what we need to do is try to find the best way to move students. So one way in the hallway with 6 feet distancing, automatically going to take away from time on learning. It's not going to be a 3-minute passing time at the high school. It's probably going to be 7 to 10 minutes to pass, which is going to take away from instruction, but it keeps people safe. Up one way, down the other, staircase is only one way. Of course, all of that thrown out the door if in fact is any type of a emergency. But as a routine, those are type of the things that we're looking at.
Other questions regarding, when will the decision be made? How can we get more information around what these plans exactly look like?
We plan to publish them ASAP in terms of probably by Friday of the everything's due the 31st. So I would say maybe that weekend we will publish it on our webpage and send out a message. Kind of just, this is what we're looking at. And then, as I said, the 4th, the 5th, the 6th, and potentially the 10th open meetings. I don't know how many school committees right now have putting themselves in the perspective of, hey, let's have a public hearing, but our school committee is going in that direction so that they can listen to what folks are saying and also taking as much information as possible. I'm also working with local area superintendents to see what direction they're in, because there's an impact to staff, to see, are we looking at the same type of model? If we're looking at the same type of model, i.e. we're doing hybrid, can we look at the same half-day schedule or schedules that look relatively the same? We're gonna see if I can put that together. And that would go Easton, Walpole, Foxborough, Mansfield, Attleboro, North Attleboro, Seekonk, Taunton, we usually invite to that as well.
Great. A few other questions regarding special education and ESL students and the remote learning that took place during the spring. I think Dr. Bayetta said it well earlier. Let's forget about remote learning in the spring. Karen likes to call it emergency teaching. What we did in the spring is not what our remote plan looks like for the fall. There is much more teacher-student interaction, much more scheduled time each day for students. Students that are on IEPs or receive ELL services will be working with their service provider in that remote model based on whatever their service grid says. So definitely.
Somebody had a great question that I think is kind of interesting to me, and that is the question about longer school days. Yes, that is a bargaining issue, but one of the options that we have is to take a look at a potential tutoring model and as a way to support families in terms of student needs. That's going to be something we're going to be looking at as part of our grant application, is how do we take a look at students that, for lack of a better word, have really regressed. They may not be on an IEP at all, or a 504. They're just, student that things didn't go well during the last few months. We're going to be looking seriously at providing something around that as well.
Yeah. A few more questions about will we release the results of the online survey? Yes, we absolutely will. We'll put it up on our website. How will busing be determined, and will we be guaranteed a seat?
Well, as we all know, public education does not run on the best interest of what's good for kids. It runs on yellow buses. I've been saying that for decades when I was a school committee member back in my hometown in the 90s. This is going to be one of our biggest headaches to deal with, depending on what model we're in. If we're fully back, we're in trouble with being able to provide that to pay and ride families. And I'm just putting it out there to be really blunt, without running some significant financial negatives and then going to the town with them. Number two, if we're running a hybrid model, we're going to have significantly less headaches when it comes to that. Remember that the hybrid model is looking at 50% or so, give or take 1 or 2% of students in a classroom at a time. So if you have a classroom of 20, your class sizes are now 10. So your bus rides are going to be less. I don't have a lot of concerns about the total number of kids riding the bus, for example, at the JCS, maybe even at the high school, but that Hay middle school run is problematic for us. So we may have to run a double run. We may have to run on a hybrid model, just a middle school bus and just a Yale school bus. That's going to cost us, but if we're in the hybrid model, that would work. If we're not in the hybrid model, then we have to take a look at K-6 mandatory and then available seating after that. We're also going to be looking to have to look at parents consider pooling. Carpooling is something that was mentioned today in the DESI call. I don't even know if that's a good idea, but it was mentioned. But it would be potential, another scenario where, you know, parents decide that they're going to drive their kids to school, which is already a problem anyways. But like I said earlier, we're going to have issues with time on learning year round when it comes to this. By the way, we're not even talking snow season, right? Remember, don't forget that thing we have in the Northeast called snow, and what impact that's going to have on all of this.
There's a question about, will next week's call be the same as tonight? Yes, it will. If you came tonight, you don't need to come next week.
If we have new information, I will make sure that two things happen. A, the first part of the meeting would be the new information, so that way you don't have to come on. So if there's new information, I will send out a communication that says that I am also going to be sharing new updated information. Let's say I get something from the state about something. I will add it to that, and I'll make sure we take care of that on the front end of that meeting, and then bring up not necessarily a sharing of everything I did tonight, but really try to get into the Q&A part of the meeting.
Okay. Will doctor's note still be required after 5 unexcused absences?
The answer is yes.
Okay.
A C19 situation is going to require a return to school note.
Are teachers going to be given the choice as well? Happy that families can choose their model. Will at-risk staff be able to work from home?
So this is an employment issue. I sent a communication today to my staff informing them that if in fact there are medical issues and or other issues that they need to begin to have those communications and discussions with their own medical provider. I've said this over and over again. I just did that with my own provider 2 weeks ago because I do have an issue, and was given recommendations. In my case, my recommendations for me, I feel comfortable with. My family knows those recommendations and what they have to do, and I'll be at work. For other situations, it could be that in fact, they need to be home. There's a process for that under the Family Medical Leave Act, and as well as the C19 Family Medical Leave Act, which is another whole acronym, and then the potential for ADA as well.
In regards to social emotional needs for students that are not on an IEP, what types of supports will be provided to them? We have our adjustment counselors and our guidance counselors available to students all the time. We're doing a lot of professional development with our staff this fall around trauma and trauma-based learning and SEL, making sure that we're allowing students and staff the time to come back, settle back in, get used to the new normal of school, spending a lot of time working on those SEL needs in the first few weeks.
I think it's really important for everybody to remember that we will probably spend whatever the first week of school looks like on really getting to know each other again, on really understanding what teaching and learning is about. All of us have been away from the traditional of it. in what we're used to. In our youngest students coming to school, that's even more important. So I believe strongly, and we've done so, we've been recognized for our SEL curriculum and what we're trying to implement. I think what we'll try to do is really spend some time on looking and seeing where our kids are before we're just saying A, B, C, and 1, 2, 3.
Question about if we were to go half days, we'll be cutting specialists. I don't know that we're looking at going half days at this point.
Half days are really not in play right now in terms of a regular model daily.
There is a question about specific platforms to support virtual learning.
Yeah, happy to share with, as soon as we conclude, in fact, the model we're doing, we're gonna be happy to share what those are with you, potentially even actually hold meetings with families, virtual meetings like this, to go over how they work, what the connection is to it. And I see Karen shaking her head, so I'm already beating to her. Karen Whisper, our Director of Instructional Tech. So we will not just surprise you with, hey, we have such and such. We will spend the time making sure that families have a clarity of how it works and so on and so forth.
And we're also looking at options for streamlining that process for both students and families with single sign-on and other techniques to support that piece at home. Because I know that was a challenge in my own house with my first grader last year. A couple people saying they're not getting emails. If that's the case, please reach out to us through Let's Talk on our district website.
Or just call the office, 508-285-0100. Ask for Laura Kazadi in the front office, and we will get your email and information and make sure that any emails we sent out, we'll double check if you're in the system. If you're a new person, we'll send an individual email.
Question about high school sports. How will that happen if they're remote or hybrid?
Yep. How's that for an answer? Yep. We really have no idea how it's going to happen. Right now, we know that the sports season has been put off until at least the 14th of September. Then practices can start, and then we'll go from there. But right now we don't have a definitive. If in fact we're in some type of remote learning, or we're in some type of, I find it interesting to have remote learning, but full remote learning, but we're going to have sports. That's going to be an interesting dynamic of how that happens. Hybrid model, that's going to cause some issues because the transportation will have to come up and figure out some models to support that.
And will our staff be talking to students about the importance of keeping masks on, washing hands? Yes.
All part of the protocol, including mask breaks, and you got to remember, K to 5 is not traditionally in pre-K to 5 is not traditionally in rows, right? They haven't been in rows in decades. They're in all different kinds of formats. To now have kids facing one way and in rows is a heck of a curveball. So we're going to have to create some type of, if you will, movement breaks for kids, depending if they're 3 feet or 6 feet. That's going to look differently.
Yeah. There's a question if there's someone in our office. Yes, the superintendent's office is open every day from 8 to 3.
We've been open since the first week of June. All staff in my office have been back. We've been utilizing masks, social distancing. We're still doing our own Google Hangouts and Zoom calls from our offices. We're doing 6-foot distancing at lunch outside. We're trying to follow and be good examples of the protocols as much as possible.
Question regarding air quality in the buildings, ventilations, and HVAC systems.
Yeah, those are all under review, but so that everybody knows, our ventilation systems in pre-K to 12, individual units and so on, are all once a year completely belts looked at, changed, oiled, and all of that as per protocol. We do 4 times a year ventilation cleanouts. In other words, full exchange of vents. We probably are going to move to bi-monthly or monthly ventilations. Our biggest critical areas to address are going to be any areas that don't have windows. And how do we help to support those ventilation issues? But we're pretty comfortable about our systems, the protocols and procedures of what those systems are. Remember that anything to do with air quality is typically done when people are in the building, not when the building is empty, because that's how you figure out if you have an air quality problem. Also, don't forget that all of our buildings are not at capacity. In other words, if a building was made for 750 students and there's only 500 students and adults in the building, those systems are actually not working at capacity They're working at less capacity, regardless of their age. We do have them checked on a regular basis internally as well as externally as needed. And then the last part is there is no more controversial part in public education that I have to deal with than air quality. I get this issue almost every single year, regardless of the building. What is air quality? What is good for me may be different for you. I may be in a room and I can't breathe at all, and 39 other people don't have a problem. It's all very individually based, but we are making sure that we have reviews of those. We are also looking at what's called ionization machines. These are machines that are placed at the openings of buildings for the purposes of literally the ionization process that takes place as you're walking in. We're looking at machinery that actually is kind of like a, if you will, a stand-up computer that actually comes in, robot-like, if you will, that actually comes into certain areas and cleans out. All of those things are in play with us right now. I would also tell you that as much as all of that is in play, none of it, not one new piece, including all of the different sanitations available to us, is 100%. They're all 99.99. You've been told at least 60%. Right? You go to the store now, it's incredible. All of a sudden, we got 60% sanitizing wipes and pumps and stuff instead of 99.99. Because, I don't know, all of a sudden 60% is good enough as long as it has alcohol in it. This is all debatable information. And it's all going to be used as a way, unfortunately, I think, to make things more controversial than they are.
Will there be protocols in place for students that are refusing to wear masks?
Yeah, we're going to probably utilize some type of, unless it's medically driven, and so forth. We'll probably, unless it's medically driven, we're probably going to utilize some type of insubordination process. It's as far as I'm concerned, if student is chewing gum inappropriately, we ask them to take it out, and they throw it out. If they don't want to wear the mask and there's no other reason, you know, we're going to get what we are definitely going to get. It's my individual right, and so on and so forth. I am very well ready to take that on, and happy to take that on with families as well. I get it. I understand it. Believe me, I don't like it. But at the end of the day, my job is the safety of the entire building.
Will things like gym, recess, art, music be taken out of the curriculum? We have no intention of doing that at this time. I
firmly believe, thanks Jen for bringing that question up. Jen probably better than anyone in the district knows this. I've been trying to build up our arts program since I've been superintendent. And I really do not want to go in the direction of not offering those types of things to students. I think there are students that are motivated by things like physical education and wellness and art and music. And robotics and woodworking and CAD at the secondary level and STEM and building things. That's how maybe they stay in school. That's how they get motivated to pass their English class or their math class or whatever class. So I have currently, unless I am held to something that I can't work around it, I have no intentions of saying that the arts should not be part of this process.
Agreed. Will our decision that we make on 8-10 be intended for the whole year, or will we reevaluate? We will be reevaluating all year long, every day. Our goal is for students to come back. And if we can do that, we want to do that. So I'm
hoping to keep the reevaluation under 8 weeks, you know, the quarters type of thing, if you will, or the trimesters, which are actually longer, 12 weeks. I'm hoping to keep it shorter than that, but I think we have to use data and we have to, you know, look at what's happening. Listen, Massachusetts did something really smart, and that was it went to the whole mask wearing situation a lot earlier than anywhere else in the country. And we were spiking all over the place, and we've been in a better place. I think any positives are unfortunate. I think any deaths are really unfortunate. But our numbers have been pretty stable, but anything could happen over the next few weeks.
Will parents be permitted to enter the school buildings?
As needed. I think is going to be our protocol in order to just try to keep things as safe as possible. But of course, we always want our parents in the building. It's just a matter of what's the visit for, what's the need. We want you to be there for your child's safety and all of that. But we're going to try to come up with some protocols for that. Most of those are probably going to be some type of a nurse situation. We're probably going to have some unfortunate protocols around maybe early childhood with testing and stuff like that. Instead of having a sit-down area like at the JCS inside the hallway, we might ask you to be out in your car like the doctor's office do now and that type of thing, but we'll wait and see on that stuff.
Question regarding middle school, like band and chorus, and what's going to happen with that. We're still waiting on guidance from the department regarding those types of activities.
Chorus and band are actually, they're like athletics. You know, they're one of the more controversial ones. So we're going to really take a look at where that happens, what our class sizes look like, and what's the best way to do it. For example, at the high school, we could move band to the auditorium or chorus to the auditorium. Same thing with the middle school. With the band, we could potentially at the Yale school or at the elementary schools use the lunchrooms when they're available. Those types of things. We're just going to have to wait and see.
There's a question regarding incorporating UV light to disinfect air in the ducts, and that's totally not my area of expertise. So I'm gonna let you take that one, Joe.
Yeah, as somebody who's learning this every day, yes, it's definitely in play. What we're trying to figure out is who are the vendors that have been working in facilities like ours, in other words, school buildings, and that becomes a little bit more difficult to actually find. A lot of this is stuff that's been used in higher education, in private business, and in hospitals. And so it is on our list. Actually just spoke about it today. Wade Lazat was informed by me to take a real look at it, as well as the ionization machines and all that stuff.
Will school start and end times be adjusted or changed with a hybrid or a full return? At this point, we really don't have any plans to adjust start and end times. We are looking at perhaps an early release day each week in order to support staff in terms of making sure that they're connecting with students that are remote, planning. It's a very different ballgame than what we're used to in the past. So we are looking at that. But overall times, no, we're not looking at that piece. There's another question here about the flu and how last year we had such a huge incidence of the flu, and that, is there a predetermined number of cases that would cause closure? And I think that I'll defer to Joe on this one.
Yeah, the flu is always interesting because we always look at that 20% number, 20% of the student population, 20% of the staff in a building, that type of thing. I've actually closed a building due to the flu in my last district for 2 days and then did deep cleaning and all that because our attendance was running at like 75% with students. So those are always numbers we're going to look. Here's the part that's going to be difficult. We all have read that the COVID-19, the C-19, the coronavirus, whatever you're calling it, and flu have a lot of the same symptoms, right? They look a lot alike in some ways. That's going to be the hysteria we're going to have to deal with. The first, we all know social media, right? I'm looking at some of my good friends that provide me some of that support from social media since I'm not on things like Facebook. We all know that the first case of the flu in any of our buildings will be the first C-19, no matter how misinformed that is. Somebody's going to say it. They heard it through the grapevine. Our hope is to be able to, I'm hoping that you folks recognize that our goal is going to be able to communicate to you as specifically as we can.
Question regarding students and teachers wearing masks and the difficulty that will go along with hearing each other. We are, having conversations about the acoustics in the room, looking at, do we need to add more FM systems? What does that look like?
Yeah, we are looking at more boom systems, literally connect and allow to project louder. There are some studies out there about a difference in decibels when you're using the masks. I think all of us, maybe when we're talking with each other as family members and you're out and about, you probably have seen that. We are moving also towards as much of the clear masks for our staff as possible, because the clear mask, literally they're masks, but they're clear here, allows for students to pick up cues in certain situations that a covered mask doesn't. And we've already ordered 2,000 of those, and we're ready to order thousands more of those as needed.
Will there be protocols for nurse visits for students that see the nurse regularly for, their own medical issues that are not related to anything?
Yeah, so the protocols will be in terms of leaving the room and having to go down because you're getting your sugar checked as a student or even an adult, or yes, we will have protocols in terms of when you leave and how you leave and all of that. And of course, many of that is around that lunchtime. We have students that need to be checked every couple of hours or on the hour. Those protocols will continue to be pretty much the same, except we'll probably do some type of, I can't call it contact tracing, but at least keeping a chart of when people are leaving and coming back and all of that stuff.
Yep. Question regarding, outside of the MIAA, would we as a district still allow teams to practice or do inter-squad scrimmages if, in fact, the MIAA, isn't quite there yet?
Well, I can tell you that as part of motivating students and seeing students already, I think that would be something that utilizing things like local data and information and very specific protocols, something that I think we should consider in the best interest of the social, emotional, physical development of kids. Kids are outside playing right now. I think many of your kids have probably been playing with other kids outside in the neighborhood in some way, shape, or form. You try to teach them the best protocols and procedures. And I'm hoping that the MIAA doesn't say we don't have sports. I would understand if they do, especially they're trying to be fair between sports, right? The contact sport of volleyball is going to be different from football and cheerleading, which I personally consider a sport, versus football and wrestling in the winter, or even hockey and soccer, or baseball and softball and track and field or just track. They all look very different in terms of contact. So I think they're trying to be fair to all the sports.
If a parent chooses to do remote, keeping their child home, can they switch to hybrid at a later point?
Yeah, that'll be a discussion we have to have. I happen again to firmly believe that we have to look at individual issues and rationales and reasons why. So I'm not saying no. I just think we have to be prepared for those types of things, and they are situations that could be very small numbers or even single.
Yep. How will teachers especially teachers of young elementary students, be expected to enforce social distancing when we all know small children can't handle that? They really can't. So it'll be interesting, right?
I would say to the best of our ability. Why am I going to come up with another answer? I mean, literally, to the best of our ability. I was just with my 7-year-old nieces. We were all trying social distancing, or 8-year-old now. You just try your best. That's all you can do is try to inform them about safety and how important it is, which I think we do for other things anyways. But I also think that, our ESY program just started this week, and the internal discussions that we were having is how difficult it is to walk into that program as an adult. I haven't gone to visit yet because to be quite honest, I'm scared I'm going to walk in and scare those kids. Walking in with a mask, and they typically see me in a suit and tie, and I'm not wearing a suit and tie right now. So, I'm just worried about how kids react to that stuff. I think we have to do it slowly. We have to try to teach them and support them and deal with the issues as they come up.
Will there be a quarantine period if a child or family leaves the state for a vacation to return to school?
Yeah, we will be absolutely trying to make sure that we're having your support in that issue. It's important, it's imperative, because what it does is it creates this system of, especially if you're going to an area like Florida, the Carolinas and so on. I think we have to have some type of rules. Again, it's an honor system. I have really no idea. Probably going to figure it out through Facebook, but the fact of the matter is that I think it's important that people recognize that when they place themselves in a situation, that then therefore they're placing everybody else in that situation.
Question regarding kindergarten screenings. Are we still doing kindergarten screenings this year? Yes, that is our intention. We get a lot of good information from our kindergarten screenings. But how those will be done is we're still trying to figure that piece out. Or will we just do some of that screening when students return during those first few weeks?
Yeah, there's a question on here about captain's practices. Yes, I can confirm that captain's practices have been stopped until the 10th of August at minimum. So that's a confirmation that 8/10. And the rationale behind that is we're 7 weeks out from the MIAA. We do have concerns about the number of students that are hanging out together on school grounds. That's the rationale. We're worried about, I mean, I know this because I'm a parent. I've been there for my kid at the high school in the last few weeks. There's a ton of kids together. They're not really utilizing social distancing and all of that. And with the MIAA announcing that the season doesn't start, really captain's practices should only be a few weeks ahead of regular sessions with coaches. So that's why we did it.
Will students be allowed to wear face shields instead of masks?
Great question. Right now, the answer is masks. However, there could be a reason for a student to be in a shield.
Will there be an isolation area for students with symptoms? Yes. Every building has a predetermined isolation area, at least one, that we have already gone through and set up for that those situations.
One of the things we're hoping to do before the start of school, if in fact we're back or have a hybrid, is to actually videotape some of our rooms, like literally take a, if you will, a shot of each classroom and really just say, hey, this is what a third grade classroom is looking like. Hey, this is how our high school, so that you folks all have an example. This is how we walk in the hallway. So that if in fact we're back in any way, shape, or form, you have some distinct information or specific information about what's happening in your child's school.
Can we clarify what grade and up will be required to wear masks?
Currently, it's on buses, everybody, in school, grades 2 through 12, and all adults unless they have a medical condition and are stating so and aren't wearing one.
There's a question about students and teachers that have preferred learning models. Will we be pairing them up? Yes, as best we can. I am concerned that there might be an unequal ratio on one side or the other. So right. Those are things that we're all kind of trying to plan the best we can with the information that we don't have. And hopefully we'll be able to change direction as we have information that comes.
Yeah, I think it's really important for everybody to recognize that there's a lot of individual attention that's going to be placed in some of these decisions to the best that we can. When it comes to a medical situation, we will absolutely adhere to the best interest of the individual's child's medical needs, i.e. shield versus mask because of severe asthma. And yes, we will probably push some type of support documentation to support us when we get questions, because these things come up. But the fact of the matter is it's very individualized based when it comes to these medical and or behavioral issues that can happen with certain populations of students.
There's a question here about students that are transitioning from one school to another, being able to come in and visit before the year starts. We will be looking at all of those, different cases, and it could be that perhaps we're doing orientation during those first few days of school, especially if we're in a hybrid model and we have fewer students. Right. But we'll look at that. Sorry about this, just looking. Questions, very specific questions regarding specific medical issues.
If you have those, listen, if you really have those and you're really concerned, do me a favor, go to Let's Talk on the district site and ask the question, or just email me directly, jbayetta@norton.cable, and I'll walk you through who we need, what we need to do, or at least I'll get you the person to talk to get you the information. We want to try to take those medical issues that some of you are concerned about and try to bring your stress level down as much as possible.
And question about, would we need to provide a doctor's note if your child wasn't able to wear a mask? Yes, please do so. There's a question about students that are in extended school year doing kindergarten screening now. Great idea, love it. Will students be evaluated in September to see if they are where they are? Absolutely. We're looking at assessment.
I think it's really important. It's a really interesting question, right? Because we've been away from traditional education for a while, and we need to settle our students in if we're back, whatever model. If we're back, hybrid or 100%, we need to settle into the school day, especially with our youngest kids. And the last thing I want to do is on the first day, give them a test. We want to settle in, get them accustomed to the schedule, and then let's assess. so that we, just like any of us taking a test, the last thing you want to do is walk into a new scenario and say, here's a test. We want to get accustomed to where we are, figure out relationships and all of that. And it doesn't have to take weeks or months to do that. You know, a few days, kids get accustomed a lot quicker than I think we as adults think. And then we move from there.
And that's it.
Okay, folks, thank you all for staying on. I know we lost a few of you probably.
All right, I found one more.
All right.
I would say in one, not be required to wear masks.
Yeah, that's a really interesting question. The studies coming out have clearly articulated that within that age group, putting something on their face actually leads to more things going onto their face, specifically with their hands. There's numerous studies that are supporting that. It's not just an opinion. So that's the reason why they're going in that specific direction. It's one of those situations where they're trying to utilize the best data available, that kids are actually grabbing onto their face and touching their face. One of the things all of us, I think, have tried to do is touch our face less, and then the more we talk about it, the more we touch our face. Yeah. It's the same idea with that age group. Hi, Sophia. Good to see you. Love seeing the kids on the call. So thank you so much. Please reach out with questions. Have a great night. Enjoy your families, and please stay safe.
Thank you all. Have a great night.
Thank you. Thank you, Ms. O'Neill.